From the holidays to different sports seasons throughout the year to spring and then summer, there always seems to be an invitation to have a drink. And several medical studies now suggest we should re-examine our relationship with alcohol. And in today's health break, also during Alcohol Awareness Month, we hear from a Savannah physician on the changing line between enjoyment and excess.
Determining do I have a problem with alcohol it can be a difficult thing to, figure out. And I think the important thing to kind of keep in mind is I feel like we have a lot of preconceived notions about what problem alcohol drinking looks like. But in reality, it can be a wide variety of issues. Sometimes we can start to see some liver enzyme elevations. We can see sometimes signs and symptoms of sleep deprivation. Sometimes we can see elevated blood pressure, and then also the mood symptoms as well. We can see anxiety, depression. There are some changes with the guidelines. I think the biggest one is, we used to define safe drinking as moderate alcohol consumption, so 2 drinks for men, 1 drink for women daily. Now it's kind of moving more towards less is more. That's still considered moderate alcohol consumption. The first step is getting in touch with a medical professional, coming in to see your primary physician, primary provider, and just kind of bringing up that you have questions about your alcohol consumption. And that way we can do any screenings to see if alcohol consumption is impacting your health. Then we can also help get you with the appropriate treatments, whether it's talking about medical therapies, whether it's talking about getting you established with a therapist. So I think the first place to start is just kind of bringing up the concerns or questions about your alcohol use with a healthcare provider.
There seemed to be a social media push about this a couple weeks ago. Maybe it was during Alcohol Awareness Month in April, saying that really everybody could benefit by cutting out all alcohol, at least cutting it back.
Yeah, I think that cutting it back is the biggest thing. And I think we're seeing more people do that, which is good. A lot of people taking this advice. I see so many more people ordering mocktails and looking for ways. If you're around people, everyone wants to take a shot. Maybe you have a shot of water or Sprite, that kind of thing. There are definitely people, I guess I would say now, getting doing things in a unique way when it comes to avoiding alcohol.
Yeah, they're also saying they're starting to kind of back off of they used to say there are some health benefits from maybe a glass of red wine a day. They're saying, yeah, there's probably no benefit from that.
Yeah.
So, anything you can do to cut back, probably not a bad idea.